Chapter 2 Inflammation. Inflammation is a vascular response to injury. Now, the 5 processes are involved in inflammation. First one is the exudation. Second is the attraction of leukocytes to the injury. Third is the activation of the chemical mediators. Fourth is the proteolytic degradation of extracellular debris. Fifth one is the restoration of the injured tissue to its normal structure and function. So, coming to the exudation, is that the exudation of fluid from the vessels. Exudation of fluids from the vessel. Then the second one is the attraction of leukocytes to the injury. Leukocytes basically engulf and destroy bacteria, tissue debris, and particulate material. So this is the function of leukocytes. And the third one is the activation of chemical mediators, very important. Then there is proteolytic degradation of extracellular debris. And the fifth one is the restoration of the injured tissue. This is the tissue repair to its normal structure and function. This is limited by the extent of tissue destruction and by the regenerative capacity of the tissue. This whole the process of wound healing. And so, coming to the cardinal signs of the inflammation. Basically, cardinal signs, the principal signs. So there are also 5 of them. First one is the rubor. Rubor is rub, coming from ruby, red. So redness caused by the dilatation of the vessels. And then there's dolor, pain due to increased pressure exerted by the accumulation of interstitial fluid into mediums such as bradykinin. So dolor is pain. Calor coming from calorie. Calor is coming from calorie. Calorie means heat caused by increased blood flow. Then there's tumor, swelling due to an intravascular accumulation of fluid. Then is functiolysa, loss of function. So it's Latin, I guess. So repeating again, rubor, redness because of the vessels dilatation. Dolor, pain due to pressure exerted by the accumulation of fluid in the mediators such as bradykinin. Calor is heat caused by the increased blood flow. Tumor, swelling due to an extravascular accumulation of fluid. And functiolysa, loss of function. And now, so the first one is the infection, trauma, physical injury, chemical injury, immunologic injury, tissue death. Inflammatory changes occur in viable tissue adjacent to necrotic areas. So the mnemonic should be tip tick, tick tip, tick tip. P is physical injury, I is infection, T is trauma, T is tissue death, I is immunological injury, and C is chemical injury, tick tip. Tissue death, immunologic injury, chemical injury, trauma, infection, physical injury. Coming on the acute inflammation. So acute inflammation involves the addition of the molecules. Addition molecules play an important role in acute inflammation. They are into 3 families: selectants, immunoglobulins, family addition proteins, and integrants. So basically addition molecules are like ISI, immunoglobulins, selectants and integrants. So now coming on the selectants, these molecules are induced by the cytokines interleukin 1 tumor necrosis factor, interleukin 1 and tumor necrosis factor. These are the selectants. Now basically there is L selectants, E selectants and P selectants. The L selectants are expressed on neutrophils and bind to endothelial mucin like molecules such as glycam-1, and E and P selectants are expressed on endothelial cells and bind to oligosaccharides such as silyl Lewis X, Lewis 10 on the surface of leukocytes. P selectants store in endothelial Weibel palette bodies and platelet alpha granules relocate to plasma membrane after stimulation by mediators such as histamine and thrombin. Then there is immunoglobulin family addition proteins. Intracellular addition molecules 1 and 2 are expressed on endothelial cells and bind to integrant molecules on leukocytes. Vascular cell addition molecules are similarly expressed on endothelial cells and bind to integrant molecules on leukocytes. Coming on the integrants, examples include leukocyte lymphocyte function associated antigen LFA1 and macrophage antigen 1 and very late antigen VLA4, which bind to endothelial IgG family addition proteins. So then there are vasoactive changes. These changes begin with a brief period of vasoconstriction followed shortly by dilatation of arterioles, capillaries and post-capillary venules, and the resultant marked increase in blood flow to the affected area is clinically manifested by redness and increased warmth of the. So the whole rubor and calor we read before were these vasoactive changes. Then there is increased capillary permeability. This results in leakage of proteinaceous fluid which causes edema. Now that's important. So causes include endothelial changes that vary from contraction of endothelial cells in the post-capillary venules with widening of interendothelial gaps to major endothelial damage involving arterioles, capillaries and venules.